Wonderful. We want to welcome all of our guests tonight for a very exciting topic. I want to introduce to all of you Dr. Conte, who is a clinical psychologist, and her field of interest and expertise is addictions. And why I felt that this was so important to talk about is I don't know if you're like me, Dr. Conte, but I've run into a lot of people who want to use CBD, but they have the fear that CBD will do and react in their body exactly like the substance that they're addicted to. And so they will absolutely refrain from even being open to using CBD. And I think this is a very important learning topic for all of our guests, for all of our business partners to understand how CBD can actually assist not only in the behaviors of those who are addicted, but also assist in the symptoms, the withdrawal, the cravings, the anxiety, the insomnia. You name it, CBD can address that. So thank you so much for sharing your expertise with us. And I'm going to let you take it away.
Absolutely. Thank you so much. I'm so excited to be here tonight and sharing this information. And I am hoping that this information tonight that's being shared will be impactful. I think Dr. Rita makes an awesome point that there's so many questions around CBD and addictions, and that we're faced with that on a regular basis because we know that addictions is at an all-time high. We've just gotten out of this pandemic and we're not even out of it yet. So things are definitely increasing when we talk about addiction. So I'm excited about being able to offer this information tonight. So thank you so much. So tonight we're going to talk about CBD and addictions. And I'm so excited again about that. Again, for all of you who are here, I hope this information will be just invaluable as you share. For those of you who are Wakana distributors, that you'll be able to share this information, as well as for those who are joining tonight to hear a little bit more about it as well. So again, very, very exciting. So our agenda for tonight, well, you're going to meet me. Who is this Dr. Rashonda Conte? We're going to talk a little bit about who I am. We're going to talk about what is drug addiction. In addition to that, we're going to talk about what are some of those treatment methodologies that are being used to help persons with drug addiction. We're going to talk about CBD and how it's used for drug addiction. And then ultimately, we're going to talk about what are some of those methods of CBD consumption. So let's go. So, meet Dr. Rashonda Conte. So, I am a clinical psychologist. I have now 27 years experience of treating clients with drug addictions. I'm currently the CEO of A New Experience Waiting LLC, as well as the president of A New Treatment Services Incorporated. And I am a Wakana distributor, and I just reached Sapphire, and I'm excited about that. But more importantly than anything I could possibly do, I am the mother of these two fine young men. So I have my Jordan, he's 22. Joshua, who is 16, Joshua's 16, he's the tallest, but nevertheless, that is my ultimate joy, the ultimate pride in everything that I do. I know Dr. Rita has a Joshua too, right?
Yes, and you are my soror.
Oh,
that's important too.
Awesome. Yes, I am a member of the elite sorority, Alpha Kappa Alpha Sorority Incorporated, and I am just elated to be a part of the Wakana family. It has been absolutely amazing and awesome. So that is me. So with that, yes, I have been working in the field of addictions for a very long time. There are a lot of persons who are definitely hurting. There's lots of pain. And so as a clinician, we have to ask ourselves first, what is an addiction? And how do we actually label someone as having an addiction? What are those characteristics that actually provides a clinician with being able to tell someone that they actually have an addiction? Well, what is addiction? It's a mental disorder that's characterized by compulsive consumption or behaviors despite negative consequences. Well, what does that mean? Well, you have persons who have had some extensive incarceration histories. You have persons who are being faced with, some women who may have children that they could be faced with having their children removed from their care and custody through Child Protective Services. You have persons who are actually using substances who may be faced with possible termination from their employment. You have persons who have spouses who are saying, hey, you know what, I'm not going to be able to do this anymore. I'm not going to be able to continue to engage in this marital union with these types of behaviors that are going on. And you know what happens with all of those things I just named? Persons continue to use. Well, when we see that as a clinician, along with some other factors, definitely, we look at history of use and what's being used and how much is being used, but ultimately the addiction is that a person continues to use despite those negative consequences. And what happens in that addiction, persons will continue to use because they're getting that pleasurable element. It feels good. And then we find that the more that they're getting that pleasurable element, the more the abundance needs to be used, right? So that in addition feeds that addiction. And then in addition to that, we find that persons who are addicted, they don't even get high anymore. That euphoria, that great feeling, they're not feeling that anymore. They're just using it in order to function normally. And that is how we define addiction. In addition to it being characterized as an addiction, it's also characterized as a brain disorder. So you may say, well, why do we look at it as a brain disorder? Well, drug addiction involves those functional changes through our brain circuits, and often that's involved in reward, stress, and self-control. So there are three actual brain areas that primarily are affected by drug addiction, and that is the prefrontal cortex, the extended amygdala, and the basal ganglia. Now I'm gonna go through what those are because the brain is so amazing. People like, oh my God, talking about the brain is so boring. Me personally, I think the brain is amazing because it is the center of everything that we are. It's the center of everything that we do. It is the center of our human being. So with that, with specifically drug addiction, those are the three areas that we're going to talk about. But let me just back up for just a second. We're going to talk about drug addiction because that's what I do. That's what I work with. That's who I see. I see persons who are suffering from opioid addictions and cocaine addictions and so forth, and that's what I've done. But there are many, many addictions. There's gambling addiction. There's sex addictions. There are persons who have shopping addictions. There are persons who are hoarders, just can't throw anything away. All of these things are addictions, but for the sake of tonight, we're talking about drug addiction. So with that, the prefrontal cortex, as you can see there in that bigger picture, you see that part of the brain that's responsible for our self-control. Well, what happens in drug addiction, that particular part becomes very challenged. That region actually regulates our ability to reason. It regulates our ability to consider consequences because there are things that we know that we can and cannot do because there are consequences. Because if we didn't think or if our brain didn't function in that manner to help us know that there are consequences that could be had that are quite negative, we would not, we would actually just go ahead and do anything and everything. But that particular part of our brain helps us to know, wait, there's some consequences that need to be considered. We got to plan things out. We can't be impulsive. But when a person is using drugs, that part becomes challenged and they continue to use despite those consequences that I talked about. So that is why persons actually continue to use drugs because they don't have that part of the brain that's helping them to reason that out. Then we have the extended amygdala. That's the smaller picture you see there. Now that extended amygdala is responsible for how we respond to stressful situations. So for a person to abuse drugs, this is a very sensitive area, and it becomes even more sensitive because when they are attempting to stop using, those withdrawal symptoms appear. So you have anxiety, you have irritability, you have depression, and you even find physical pain that occurs. Well, this in turn makes the person continue to have those drug-seeking behaviors, and then not to get high, but they're just trying to relieve and alleviate those withdrawal symptoms. So most persons, when you hear about drug addiction and you hear about withdrawal, most persons think, okay, withdrawal is physical. They're going to be shaken. We see movies, you see, you know, maybe you've looked at documentaries where you've seen persons who are going through withdrawal from a certain substance, and they're shaken, they're sweating. And not to say that those things don't exist, because they do, but those are not the only withdrawal symptoms that a person experiences. And again, those anxiety, those are some mental withdrawal symptoms that persons experience. Those are some emotional withdrawal symptoms that persons experience. People even go through mourning the not using drugs anymore. They've become so accustomed to operating on a day-to-day basis of using a substance that when they actually are put in a position where they are no longer going to use, they actually mourn the loss of that drug. So there's many, many forms of withdrawal symptoms. And then lastly, that last brain area that I'm going to talk about is what we call the reward circuit, and that's the basal ganglia. So that particular area of the brain is responsible for all of our positive motivations. So it produces those pleasure responses. So when you eat that really good meal, or you're socializing, having a good time with your friends and family, and even sex, this particular area of our brain is what gives us those positive responses, those pleasure responses, those feel-good responses. And because the basal ganglia is responsible for those biochemical responses, which actually forms habits, this is the area that's probably the heaviest that's affected by this by substance use, because that is what helps the person to create the habit of using substances. Also in this particular area of the brain, we talk about the feeling good is normally when dopamine is being released in the body. And that's what gives that intense feeling of euphoria. Again, that feel good. But when persons are continuing to use drugs and alcohol, what happens is the brain begins to adapt to that. So the brain adapts and it says, okay, I don't need to produce as much, because we normally produce dopamine. Again, the eating, socializing, having sex, shopping, just feeling good, listening to good music, our body will automatically just produce those good feelings and that's the dopamine. Well, what happens is, it's almost if you can imagine a baby pool. So you have this baby pool that can only fit, you know, a few gallons of water, right? We're just going to say that just for the sake of this example. You have this baby pool and it can fit a couple of gallons of water. But over here, you have this mountain that is just pouring in water. Well, this pool can only hold but so much. Let's think of that baby pool as our bodies. Our bodies can only hold and be able to tolerate so much dopamine. The brain knows that, okay, there's this flood happening here, and that's what happens when persons use drugs. So on a normal basis, we feel good, dopamine's being released in our bodies, and then we have this flooding that comes in because the person has now used heroin. The person has now used cocaine. The person is now taking a few extra drinks of alcohol, and now that dopamine has now increased significantly. Well, when that happens on a consistent basis, the body starts saying, hey, you know, I don't need to produce as much dopamine anymore because I'm getting it on a regular basis and it's too much. It's like if you have loud music and the music is so loud, what do we do when that music's loud? We turn it down. Well, that's what the brain does. The brain turns it down. I don't need to produce that much because this person is getting it on a regular basis. I can just stop. But then we want to ask that person to no longer use the drug. Well, then what happens? They're not going to experience the same level of pleasure to those normal things that I talked about earlier because the brain is no longer producing the dopamine as it normally would do. And that's because of that flooding of the substance. So now I did share with you that I am the CEO of a drug treatment facility. And I'm going to show you, this is a brief video, and I want you to see this, and it further validates the depiction of what drug addiction brings, the despair, the pain, but then there's something that you're going to see at the end. So I'm going to let you see that for yourself. What happened? So I am very sorry. I wanted to make sure there is sound, but I want you to pay more attention. I'm not sure what's going on with the sound, but it's more just the pictures. And there's no talking, there's music in this, but I want you to just continue, just notice the pictures. I have to tell you the music, so there was some pretty somber music in the beginning. I'm not sure why it didn't play. So, you know, this video absolutely depicts and shows the despair of drug addiction. And then ultimately in the end, you saw the flip side, that there are persons that can live healthy and productive lives. And that's why I do what I do. Now, while I do see that beginning of that video, those horrific photos of persons who are incarcerated, those persons who are going to the emergency room, and those persons who, unfortunately, there's photos of cemeteries, because we do know that we have deaths behind drug addiction. And that's why I do what I do, because I want to see people get to the very end of that video where you see families together, you see people purchasing homes, and you see persons getting jobs, and you see people graduating. That's why I am in the field that I'm in, because I want to see people do that. And I know that those of you who are watching tonight, you too want to see that happen, especially for those of you who are Wakana distributors. You want to see people live healthy and productive lives as well. So we're all in this thing together. Now, how do we do that? How do we get these persons to get from, as you see this picture here, there's an addiction that's leading this way. You see the arrow going another way. And then you see life on the other side. Well, there is definitely life on the other side. And that is why we do what we do. And I'm saying we, not just me at this point, it's we, because we know that there's life, and we're going to make sure that we help people to get to that life and that healthy and that happiness. So these are some of the treatment methodologies that you see here. We have dialectical behavior therapy, educational classes, one-on-one counseling, family therapy. You see all of that there. But for the sake of tonight, we want to talk about how CBD can be a viable alternative, because most persons who are suffering or who have or in the or recovering from a drug addiction, actually the reasons why they end up going back to using drugs is not because they have no willpower. You know, you have persons that say, oh, they're just weak. Or you have persons that say, oh, well, if they just don't want to do it, they just won't do it. Well, you know what? It's not that simple. Addiction is a very arduous process. Recovery is an arduous process. And so we want to be able to at least shed light on why that continues to happen. And that's what we're going to talk about right now. But more importantly, we're going to talk about how CBD can help. So how does CBD work for drug addiction? Well, we know that CBD is just one of those hundreds of active compounds that is found, and it's found in cannabis sativa. And unlike THC, CBD doesn't have those intoxicating properties. Wait, I'm gonna change this. Okay, CBD doesn't have those intoxicating properties. But what it does do is that it offers a range of possible health benefits, which include stress relief. It serves as an antioxidant. It actually serves to help with any anti-inflammatory needs that the body may have. And so those are all those medicinal benefits to taking CBD. So CBD and other cannabinoids work by influencing what we know as the endocannabinoid system. The endocannabinoid system is a system that is in our bodies. We already have it. Whether you use cannabis or not, whether you use a substance or not, we have this system in our bodies. And what it does is it helps to regulate and wants to bring us back to what we call homeostasis, which ultimately just means stability. Our bodies are going to fight by any means necessary to get us back to that normal feeling. So when persons are in pain, when persons are anxious, persons are depressed, persons have all of these ailments, these medical ailments, our body wants to fight to get us back. So it doesn't work any different for persons who are suffering from drug addiction. You know, when we have that influx and that flood of that dopamine that is being released in the person's body from using drugs, the body knows that it wants to get back to feeling stable. It doesn't want to feel that. So that is what the endocannabinoid system does, and it works for us. And we want to now take advantage of that with CBD around the addictions. So I do have here where we talk about some of those receptors, and you know, for some, you know, understanding receptors is not always easy to understand. So for me, I'm going to help you just a little bit. So if you think about in your body, there are these little cups. There are these cups that are there and they're empty. And the goal for CBD is to fill those cups with whatever the need is. So whatever that need that arises, if it's withdrawal, if it's pain, whatever the pain is, if it's that again, the anxiety, the depression, whatever that case may be, the endocannabinoid system have those receptors that are sitting there like cups just waiting to be filled with CBD. That's the easiest way to look at that. So let's talk about CBD for opioid addiction. So when you look at opioids, you know, right now that has been a major topic we are definitely faced with an opioid epidemic. Through this whole pandemic season, there have been a rise of numbers of persons who have overdosed on opiates, and it has been very alarming. But not that it has been that it's something that's brand new, because it's been happening, but we just know that the numbers have definitely increased. And in addition to that, what we're finding is, we had these pharmaceutical companies that were claiming that, oh, they were going to prescribe all these opioid painkillers. They were safe, they were non-addictive. And then the prescriptions were just being written, just in leaps and bounds, just the prescriptions that are just being put out there with persons. And then what we found, that those claims were not true. It is highly addictive. And then you have all of these persons who are misusing their prescriptions, and they're actually leading them to these addictions that has led to all of the numbers of opioid overdoses, because persons think that, oh, well, I'm not really a heroin user because heroin is an opiate. I don't use morphine, so I'm safe. I can take this pill because you know what? My doctor prescribed it for me. So I'm okay. And you know what? If I take one, if I take two, if I take three, whatever the case may be, I'm okay because my doctor prescribed it. Well, we found that that was not true at all. It is notoriously addictive, and the withdrawal symptoms is what makes it very challenging for persons to no longer use that substance, because the withdrawal symptoms are so severe. So you find that persons who are trying to no longer use those opiates, they're sweating, they're experiencing nausea, they're vomiting, they have these extreme body aches, anxiety, and also insomnia. So, okay, what are we going to do about that? Then let's talk about cocaine addiction, and I'm going to get to what we're going to do about it. But let's talk about cocaine addiction. Well, we know that cocaine too is very highly addictive. It's the second biggest killer after opioids. So as well as it having these powerful cravings, people who try to come off of cocaine report that they have these withdrawal symptoms that also include being very tired, fatigued, having high levels of anxiety, highly irritable, agitation, paranoia. All of these are withdrawal symptoms. So you have this person who's trying not to use an opioid, you have these persons not trying to use cocaine, but yet then they experience all of these things, these feelings that just don't feel good. Well, we know that persons who are have definitely been using drugs on a regular basis, they know how to not feel that. So then what happens is it provides and pushes that craving for them to want to go out and get that substance, because they know how to get rid of those nasty, not too good feelings. So CBD may prompt users to feel relaxed and feel less stress. And that's very important in the recovery of those persons who are suffering from cocaine addiction, because they want to feel the relaxation. They want to not feel that stress. They want to not feel that agitation. They want to not feel that those high levels of anxiety. So that's what CBD can actually do. Let's talk about alcoholism. Well, we know that alcohol too is an addictive drug. Now, we know that it's one of the most commonly used substances out there, but unfortunately, we're finding that consumption of alcohol is actually increasing. That's increasing pretty much as well. Now, we know just like any other drug, addiction to alcohol can have some of those same major repercussions on the body. So alcohol withdrawal can cause symptoms including anxiety as well, irritability, and you're going to hear that some of these withdrawal symptoms, you hear them pretty much repeat for the different substances, but because the body, when it's no longer getting that substance, it's going to feel something. And that's when I talked about earlier about when you have that flood of that dopamine, and when it's no longer existing, the body then feels it. And then it shows and it manifests itself in the anxiety, the irritability, the sleep disorders, tremors, sweating, nausea, hallucinations. So there's actually been actual studies that's been done that shows where CBD can directly reduce the consumption of alcohol in persons who have alcohol use disorder. So we're not even talking about withdrawal. We're talking about studies that have actually proven that alcoholism is actually, even just the drinking of a drink for persons who are suffering from an alcohol use disorder, actually taking in CBD, actually totally reduce their numbers, or drastically, we won't say totally, but we'll say drastically reduce their numbers, reduce the amount of alcohol that they would normally consume. So let's talk about tobacco addiction. Well, we know that this too is another widespread problem, not just nationwide, but around the globe. The withdrawal symptoms may not be so severe as opioids or cocaine, but nevertheless, those withdrawal symptoms can still be enough that it would keep people continuing to smoke. Even though they know that there are long-term health risks to tobacco use, they continue to smoke. Why? Because they don't want to feel those withdrawal symptoms. But we also know that CBD, because again, studies and research have shown that CBD definitely helps with those nicotine withdrawal symptoms. So there's one study where they had 24 smokers and they divided half of them. So they had a half of the subjects with an inhaler, okay? And that inhaler had CBD. The other half had probably water, okay? But the subjects didn't know what was what. And researchers actually asked those individuals to use their inhalers whenever they felt the urge to smoke. Well, in the group of individuals who actually had the inhalers with the CBD, they found that their tobacco intake was actually reduced by 40% in comparison to those who just had the water or whatever it was they gave them. So, which was a true indicator that CBD actually helped to reduce the urges to smoke. And in addition to that, there's another study, and I don't have it here, but there was another study where they actually had 30 smokers. And in that study, the researchers asked them not to smoke. They asked them to abstain from smoking overnight. And that if they did not smoke overnight, they were going to, in the morning, some were going to get CBD, or they were going to get a substance that was going to help them. But they didn't really share who was going to get what. Again, just like this particular study that's here, that's listed. And what happened was they actually gave CBD to half of those subjects, and then they gave the placebo to the others. And what they did was they actually showed them photos of persons smoking, or they showed them videos of persons smoking, just to see who was going to get that craving, because they hadn't smoked overnight. And they had them in this room where they were actually able to observe them to know that they actually had not. And so those persons who actually got the CBD, when they showed them the photos the next day, and the videos of those persons that were smoking, it may have been pictures of cigarettes and the smoke, and someone maybe even inhaling on or puffing on a cigarette, they did not have that urge or that push and desire to get the cigarette, while those who did not get the CBD did. So that is how we now know that actual CBD for tobacco addiction is absolutely an alternative solution. So what should an individual who's battling addiction, what should they consider when they're looking at taking CBD? Well, there's some suggestion that the most natural way to get the CBD is by smoking it. So now we do know that if a consumer is smoking the CBD, they still may be consuming the potentially addictive substance THC. So consumers may not be sure how much CBD they're actually getting in each inhale that they're getting, which is why it is important for Wakana that we absolutely push Wakana products. And I'm going to talk a little bit about that. But again, let me go back. So persons do not know what they're getting. So we need to make sure that persons who are battling addiction, when they're looking at taking CBD, or they're considering taking CBD, that they take a look at that. You have to know what you're getting. You not only have to know what you're getting, you have to know what's in it. And that's why Wakana is so important. But again, I'm going to get to that. So there are these methods of CBD consumption. And first, we're going to talk about smoking. So what constitutes smoking? What is smoking for those of us who may not know, right? So smoking is defined as a practice in which a substance is burned and the resulting smoke is breathed in to be tasted and absorbed into the bloodstream. So you have the smokable hemp, you have the smokable CBD oil. Well, one, it's almost instant circulation. The beneficial effects can be felt pretty instantaneously as it is absorbed through the lungs and directly transported into the bloodstream. It's relatively inexpensive when you are considering smoking. And all that's needed is you need the hemp-based CBD flower, you need the smoking apparatus, which is a paper, a bowl, and a lighter. I've actually gotten some tutorials on that from some of my team members. The Smiths in particular actually did a Zoom tutorial with me, which I so appreciated. And nevertheless, also smoking, we found, is much, much safer than smoking cigarettes. So there was a study that was done by this gentleman by the name of Robert Melamede, and it was published back in 2005, and it was called Cannabis and Tobacco Smoke Are Not Equally Carcinogenic. Well, carcinogenic meaning cancer forming. And it states in that study that CBD smoke and tobacco smoke are not the same. CBD smoking is very much safer than smoking cigarettes. The next method of consumption, you have vaping. Well, what is vaping? Vaping is short for vaporizing, which uses a stream of heated air to vaporize the active ingredients in a substance that's without combustion, which happens with smoking. So vaping CBD oil simply means you're vaporizing the cannabinoids into a vapor that can be inhaled just like smoke, but it is not smoke. It's not that combustion. So you have vaping hemp, you have the CBD oil. The benefits of that is that it's almost instant circulation. Many users describe that they get this instantaneous effect when they first vape CBD, as opposed to waiting as long as 30 minutes for the digested CBD to start circulating, which I'm going to talk about the digested CBD. It's a great way to take CBD for those who are looking to use it to help treat conditions such as seizures, chronic pain, bouts of anxiety, and where you would want the CBD to start doing its thing as quickly as possible. It reduces toxic compounds that are found in smoking. And again, there have been studies. I'm a psychologist, gotta read studies, gotta research. There have been studies that's done that shows that vaping drastically reduces the formation of any of those toxic compounds. There's less irritation. So that vaporizing actually eliminates those irritants that are present when you're actually smoking. And it's very subtle. In addition to being subtle, it's actually very discreet. Very discreet. You have those vape pens. Minister Mooney has actually showed me that, and that you can actually take the CBD with you on the go if need be. Then we have the ingesting and infusing. So ingesting CBD just means this, that you're actually eating a product that contains the CBD in it, and it actually goes through your digestive system before it actually is circulated through the body. So we don't want to confuse that with the sublingual intake that people take where you actually place the drops under your tongue. It's different. So what happens is persons infuse, they actually infuse the CBD in foods, in desserts, in drinks. And so we find that that's very versatile. It's tasty, it's easy for those first timers. And we should definitely be mindful that not everyone views smoking and vaping in a good light. We have to be realistic that there's some persons who see a person vaping, smoking, oh, look what they're doing, right? So even if it's something that is as beneficial as CBD, we know the great benefits, the wonderful benefits of CBD, but nevertheless, if someone sees it and they know, even if they know it's CBD, they still may have their own personal opinions about it. So it's actually a great way for persons to actually rev up their body's endocannabinoid system without the hassle of smoking or vaping, if it's actually an uncomfortable option for someone. And so there's now certainly if you want to diversify later, if a person wants to diversify their intake later, they can always do that. But starting out, just putting it in food, putting it in drinks is a really easy way. And I have to tell you that my desire or interest in CBD did not start out with my profession. It actually started out with this way in particular, which is very near and dear to me, because my mother, unfortunately, was diagnosed with dementia. And that was a very painful diagnosis because my mother has always been this person who has been a rock. And my mom and dad, I mean, amazing individuals. I love them both so much, and they have definitely played a huge role in who I am today. And so I'm so thankful to God that I have them and that I still have them. But unfortunately, my mom was diagnosed with dementia. And it was very painful for us. And in addition to her being diagnosed with dementia, we started noticing that the symptoms that she was displaying were progressing. And it was progressing so quickly that my sisters and I, there are four of us, four girls, always wanted a brother, but I got two boys, so I still got my boys. But nevertheless, we didn't know what to do. And when we would have conversations about what are we going to do, we started thinking, you know, ultimately, is this going to lead to us having to not have her with us? Are we going to have to put her somewhere? Because how are we going to manage this? Because the symptoms were just progressing so quickly. And we're trying to grasp it all. And me being the researcher that I am, I'm researching, trying to figure out, you know, what is this dementia and what should we be looking for? And I stumbled across an article that talked about CBD and dementia. And that was forever life-changing for me. And it was not just forever life-changing for me, but it was forever life-changing for my sisters, because we then found there was something that gave us some sense of relief to say, hey, let's try it. And I actually reached out to the individual, Miss Erica Zachary, who shared with me, and she said, absolutely, I can get you the CBD. How do you want to get it? And I'm thinking, okay, my mother's behavior was at such a place where she was on some antihypertensive medications. We were also seeing a memory doctor who prescribed some patches that we were using for her that was supposed to slow down the memory loss. Can't avoid the memory loss, but it was supposed to slow down the memory loss. So we were doing that. And but she had become very, very, very not wanting to take medication. And so I'm thinking, how am I going to get this oil under her tongue if she's not going to be amenable to that? So when I spoke with Erica, and she said, well, why don't you try the water soluble drops? And I'm thinking, okay, yeah, probably will have to trick my mother, but we've got to do something. My sisters are like, look, we got to do something. So we actually went this route that we're talking about right here, where you can actually ingest them and put them in in foods or put them in a beverage. And what we did was we started putting those drops in her coffee in the morning or her juice, and she loves Pepsis, and so we started putting them in her Pepsis. So that she wouldn't know what we were doing. And I'm telling you, beyond measure, the change was so drastic that we saw that we could sit and watch a movie with her. We could sit, she loves music. She still has this awesome personality. That's just who she is. And we were able to see that. And my sisters, we were singing beyond, I mean, we were singing because we couldn't believe that we saw this drastic change in her. So that is what got me introduced to CBD, and to see it work for her and to be able to use it in this manner, the way that I just talked about, was just amazing, because we never had to let her know what we were doing. We just put it in her drink, put it in her food, and she's fantastic and she's great. So I'm just thankful for that. I'm thankful to Wakana, and because it was a Wakana product that we actually used with her, and it gave us what we felt was, it just gave us a breath of fresh air. And I will just forever, forever be grateful to Wakana and this product. And so to talk about it in this manner now, with such passion, is because I know what it did for me. I know what it did for my family. Now, yes, my profession is a psychologist. Yes, I work with persons, and we're talking about addiction tonight. And I absolutely know that it will help these individuals as well. But I'm just talking about, it didn't even come to me in the form of working with my clients. Now it is, of course. I will absolutely have this as an option for my clients. But it ultimately started with my mother. And for that, again, I am just forever, forever, forever grateful. So then we say, why Wakana? Well, we know that these are premium products because I talked about in the previous slides where we talked about how persons have to be sure what they're getting, and you have to be sure that you're getting high quality products, and that is exactly what Wakana is given. They're premium products at affordable prices. They have full panel testing, it's organically grown, and they have third-party testing. So third-party testing is very, very, very important to me because it's not Wakana talking about Wakana's products. It is a third party that's saying, okay, this is definitely a high quality product, and that is very important. So in conclusion, whichever product someone chooses, they should always read the instructions carefully before using the product. They should always begin with the very minimum per day and gradually build up to whatever it is they feel that they need. And then although CBD may help with symptoms of addiction, it is not a substitute at all for proper medical care. If someone is battling addiction, they should always, always, always speak with a qualified healthcare professional. And thank you very much for taking this time with me. I hope it was beneficial. And I will turn this back over to you, Dr. Rita.
Wow, wow, wow. That was a phenomenal presentation. I want everyone to put in the chat box how amazing that was, how informative, impactful, and the story, the testimony about your mother. That is powerful. And I want to thank you. We are going to take questions. So put those questions in the chat box. I do have the Wakana Medical Advisory Board. They're on the panelists. They're waiting to ask questions as well. But I want to thank you again, Dr. Conte. We're going to spend 5 minutes for those guests on the line just to look at the products that you were speaking of. And I also want to get your contact information. So if you could put that, Dr. Conte, in the chat box, we would really love to get your email address. We promise not to overwhelm you, but it's always good to have that resource when we need as Wakanapreneurs. But I do, if you're a healthcare professional, I do want to just add that Dr. Conte and I can provide you with the science. The science, there are clinical trials that show that CBD can assist those who have cigarette addictions. There is studies, clinical trials that show that those who are alcoholics, who have, alcoholism and alcohol is a neurotoxic. It can cause the damage and death of nerve cells in your brain. CBD has been shown to be a neuroprotectant. There's studies that show that CBD can help those who are heroin addicted to prevent those cravings and even relapse. There are studies also that show that CBD can counterbalance the high in those who are even addicted to marijuana, to weed. So those studies we have, Dr. Conte and I have, we can share those studies with you if you want to read more about it. But just a little bit about our products, as Dr. Conte said, our products are third-party validated. We have certificates of analysis on every single product, and that's very crucial. Also, the FDA does not allow us to make claims. Please do not go out and say, well, Dr. Conte said, if you are addicted to heroin, this CBD tincture will cure you. No, we cannot make claims. We cannot make diagnosis. We can't make any claims regarding treatment, cure with the FDA, okay? So just know, be careful on how you address your wording. CBD can assist with some of the symptoms that alcohol or heroin or cocaine addictions can present. Certificates of analysis are there. Dr. Conte spoke about different ways that we can consume CBD. One way is putting the oil underneath the tongue. We have amazing tinctures. Hempranium MD is our most potent product. That is for really someone I would recommend that has more of a severe challenge with addiction, as well as we have our Hempranium 500 milligrams. That's more for a mild to moderate addiction that you are trying to assist someone with. And then the power water soluble. You know, Dr. Conti spoke about her mom and dementia. This is a great product, not only for those who are demented and have cognitive functions, but we know even in severe alcoholics, they have a cognitive dysfunction where a power water soluble would be great for that sort of person. And then the power culinary for those who want to bake or cook with CBD. Again, we can provide you with dosing charts depending on the weight. There are gummies that are great because when we talk about addiction, Dr. Conti was very, very clear that the withdrawals can be awful. The insomnia, the sweating, the nausea, the vomiting. Let's talk about those who are addicted to opioids. They are addicted to opioids, and I've seen patients, they had a hip replacement and they've become addicted to opioids because opioids should not be used long-term. They should only be used for that acute surgery, and after that, wean those patients off. But the gummies are a great option for those who have insomnia. They can't sleep, they have inflammation, they have pain. And then our power topical products. These are products that can be used in lieu of those who are using opiate for pain, severe pain. So we have Dr. Rita's Rub, we have the 500, the 400 milligram. And then the fast acting products are great. Our cartridges, our pre-rolls, our flour, all of these products are very effective in getting in the bloodstream quickly, within 1 to 5 minutes when we're dealing with those who have those addictions. So thank you, Dr. Conti. Those are our Wakana products. You can always reach me at RitaMD at wakana.com. But we're going to take some questions now. And I'm just going to kick it off and just ask you, Dr. Conti, how do you address someone who says, I have an addiction, I don't want to take CBD because I don't want to be addicted to CBD?
Well, how I would answer that is CBD is not addictive. CBD is not the same as taking a narcotic. While I definitely understand, and we find that a lot, Dr. Rita. I actually have had persons that have said to me, hey, listen, you know, if a person has suffered and is currently in recovery, you know, why should we offer yet another substance? And just to go a little bit further with that answer is, we know that a person who may have had an opioid addiction, we will often tell them if they're going to the dentist, hey, inform your dentist. If you are, you know, if a person is in recovery for an opioid addiction and they're having a baby, they're gonna tell you, they need to tell you, hey, listen, because you need to know what you don't want to give them to trigger possibly something that could actually have them go back to using opiates or an opioid. So CBD is not addictive. It is not a narcotic. It is safe. Yes, it is coming from the from the marijuana plant, but it is that extraction from the plant that has medicinal effects, not addictive properties, not psychoactive properties. And so that's what makes it safe for those persons who are in recovery to use.
Thank you so much. Very, very, very good. I have a question about seasonings. What questions do you have about seasonings? You can put that in the chat. If you have any questions, the Wakana Medical Advisory Board, please unmute yourself if you have questions as well for Dr. Conti. We have 3 minutes. We are respectful of everyone's time. We have 3 minutes before 9. If you have any questions, just let us know.
I did that good. You all
You
understand?
did that good. My soror.
Oh, that's awesome.
My soror did that
yes.
good. The Divine Nine, we got to get
That's right. That's
I see
right.
you, Dr. Crawford.
That's awesome.
Dr. Conti, I just want to say I learned a lot today. This was very informative.
Wonderful.
And especially, you know, we know about the addiction of the opioids, but we don't know, you know, don't really consider alcohol as an addiction. So, and smoking is an addiction too. So that's great that you brought those points out.
Perfect, perfect. Thank you, Dr. Crawford.
And chocolate, and shopping, and gambling.
And it can go on and on and on.
On and on. Yes, Erica.
I'm removing my mute button. Okay, sorry. Hi, so I mentioned to somebody that you had a new program with Dr. Conti, so I just wanted to know where the program is.
So I am in Baltimore, Maryland. I know that through this extensive career, and I didn't share that, Dr. Rita, but I have been overseeing drug treatment programs in Washington, D.C., as well as Maryland, but I am in Baltimore City. And so just get my contact information, Erica, and have that person to reach out to me.
Thank you.
So what would you recommend for someone who has a cocaine addiction? Which product would you recommend?
So what kind of product that I would probably recommend first would be the smokable hemp, the flower, and using those vape cartridges. Because it's so immediate, and a person who has experienced a cocaine addiction, they're used to the immediate, that instantaneous effect. So you want to be able to have that same feeling. They're not going to want to sit and wait for an oil to take effect. They're not going to want to wait for, you know, the ingestion of that edible to go through the digestive tract and then, you know, ultimately be in the bloodstream. They're not going to want that. So we want to definitely have a person to get that instantaneous effect if there's been a cocaine addiction.
Awesome.
And
so
amphetamines as well.
And amphetamines as well.
Yes.
So that premium flower, our pre-roll, or our vape cartridge.
Absolutely.
Those fast-acting products.
Absolutely. Absolutely.
Awesome. Well, it is 9 o'clock and we want to thank you again. You were phenomenal.
Oh, awesome. Awesome.
I have the best medical advisory board in the world. What awesome. You guys all rock. You are amazing. But thank you, Dr. Conti, for all of this knowledge. Thank you for your time. We're grateful and we appreciate you. And we'll see each and every one of you next week, Wednesday. Your contact information again?
I actually put it in the chat.
You did? Oh. Okay.
I did. I put my email address and my number.
Wonderful. Well, thank you. I see it there. Thank you so much.
Absolutely.
Yes. Have a good night, everyone. And we will see you.
Thank you so much.